Hello there, thanks for joining. My name is Joshua Raber. I will be presenting novel application of spinal cord nerve stimulation in the treatment of Tietze syndrome, a case report. To start off with an introduction, chest pain accounts for nearly 1% of all outpatient physician office visits, and it is actually the second most common reason for individuals to visit the emergency room. However, only 1.5% of these outpatient visits culminate in a diagnosis of either cardiac etiologies, and as few as 1 in 10 ED visits are confirmed to have acute coronary syndrome. Furthermore, about 50% of these chest pain presentations are actually due to a non-cardiac, non-pulmonary etiology and are usually musculoskeletal. However, musculoskeletal causes are often confounded and misunderstood. Tietze syndrome is believed to be a result of recurrent microtrauma characterized by painful localized inflammation and swelling of a number of joints in the chest and neck. MRI has revealed localized cartilage thickening, bone marrow edema, and increased gadolinium uptake in areas of thickened cartilage, subchondral bone marrow, joint capsules, and related ligamentous structures. These aforementioned findings of imaging support the presence of chronic inflammatory changes which may lead to chronic pain and swelling that can mimic tumors, atypical chest pain, acute coronary syndrome, pneumonias, and other severe disease processes. Finally, the chronic inflammatory changes may also infiltrate surrounding tissues, leading to nerve root irritation and subsequent neuralgia, which may ultimately progress to radiculopathy affecting the neck, shoulders, and arms. The resultant chronic neuropathy has historically been treated with nonsteroidal anti-inflammatory drugs, antidepressants, anticonvulsants, opioid analgesics, and local nerve blocks. However, the role of implantable neurostimulators in the treatment of Tietze syndrome have not well been described yet. Moving on to our case presentation, we have a 73-year-old female with a past medical history of back problems, eye disorder, gastroesophageal reflux, and former smoking status who presented to the clinic with discomfort in her chest. Recent illness was significant for multiple episodes of severe pneumonia, for which she was intubated, underwent 4 thoracotomy procedures, and was treated in the ICU for a period of 8 weeks. Further interview reveals that she describes this pain as severely debilitating and states it was an 8 out of 10. There were also associated episodes of swelling and edema superimposed on the painful area, and she also reported occasional burning and tingling which radiated to her left shoulder, left arm, and the left upper side of her jaw and face. Musculoskeletal exam revealed moderate tenderness on the spinous processes T8 to T10 and notable tenderness on the front parasternal area near the left sternocostal joints T8 to T10, with evidence of swelling and edema measuring approximately 12 inches. After failing conservative therapies, including trigger point injections and autologous platelet-rich plasma replacement, the patient underwent fluoroscopic guided placement of a permanent neurostimulator. Intervention and surgical techniques of this intervention are described on the PowerPoint presentation, and images obtained intraoperatively reveal introducer advancement and placement in multiple planes, as well as leads 1 and 2 placement confirmed in multiple planes as well. The results of this intervention and treatment, as reported by the patient upon follow-up, resulted in approximately 90 to 100% improvement in her pain, as well as ultimate improved daily function and ability to resume normal daily activities. In conclusion, the accurate diagnosis of Tietze syndrome expedites patient treatment, pain management strategies, and reduces unnecessary workup. Historically, Tietze has been treated with nonsteroidal anti-inflammatory drugs, antidepressants, anticonvulsants, opioid analgesics, and local nerve blocks with varying patient success. However, results from this case report suggest the role of implantable neurostimulators in the treatment of chronic neuropathy in the setting of Tietze syndrome is a promising option, and their use may become a mainstay treatment choice in the future. Thanks so much for joining. Have a great day.